This pain relief PM product contains two medications, acetaminophen and an antihistamine. Acetaminophen helps to reduce fever, headaches, backaches, and muscle strains, while the antihistamine can also be used as a nighttime sleep aid. It can also help relieve allergy or cold symptoms such as watery eyes, itchy eyes/nose/throat, runny nose, and sneezing. It is important to note that cough and cold products have not been shown to be safe or effective in children younger than 6 years old, and some products are not recommended for use in children younger than 12 years old. Always consult your doctor or pharmacist for the best dosage and timing for using this product. And remember, this product does not cure or shorten the length of the common cold and may cause serious side effects if not used properly. Do not use this product to make a child sleepy, and be cautious of other cough and cold medications that contain similar ingredients. Always ask your doctor or pharmacist for other ways to relieve cough and cold symptoms. When taking pain relief PM, be sure to carefully follow the instructions on the product package. You can take it with or without food, but if you experience stomach upset, taking it with food or milk may help. If you are using the liquid form, be sure to measure your prescribed dose using a medication measuring device or spoon. If you are taking extended-release capsules, swallow them whole and do not crush or chew them. The dosage of pain relief PM is based on your medical condition and how you respond to the treatment. It's best to take pain medications at the first signs of pain, as waiting until the symptoms worsen may make the medication less effective. For adults, do not take this product for pain for more than 10 days, and for children, do not take it for more than 5 days unless directed by a doctor. Similarly, do not take this product for fever for more than 3 days unless directed by your doctor. If your condition lasts or gets worse, or if you think you may have a serious medical problem, seek medical help immediately. Some common side effects of pain relief PM include dizziness, drowsiness, constipation, stomach upset, blurred vision, and dry mouth/nose/throat. If any of these effects persist or worsen, consult your doctor or pharmacist. If your doctor has prescribed this medication, they have determined that the benefits outweigh the risk of side effects for you. Most people using this medication do not experience serious side effects. However, you should contact your doctor immediately if you experience any serious side effects, such as mental/mood changes, like confusion, or trouble urinating. While rare, a very serious allergic reaction to this drug is possible. Seek medical help right away if you notice symptoms such as rash, itching/swelling, especially of the face/tongue/throat, severe dizziness, or trouble breathing. It's important to note that this is not a complete list of possible side effects. If you experience any other effects, be sure to contact your doctor or pharmacist. As for the optimal timing and daily dosage, you should follow the instructions provided by your doctor or the medication label. It's best to take pain relief PM at the recommended time to ensure its effectiveness. Acetaminophen is an ingredient in pain relief PM. Taking too much acetaminophen can cause serious liver disease, so adults should not take more than 4,000 milligrams a day. People with liver problems and children should take less acetaminophen. It's important to check the labels on all your medicines to see if they contain acetaminophen and ask your pharmacist if you are unsure. If you take too much acetaminophen, seek medical help right away, even if you feel well. Symptoms of an overdose may include nausea, vomiting, loss of appetite, sweating, stomach pain, tiredness, yellowing eyes/skin, and dark urine. Daily alcohol use, especially when combined with acetaminophen, may damage your liver, so it's best to avoid alcohol. Before taking pain relief PM, it's important to tell your doctor or pharmacist if you are allergic to acetaminophen or antihistamines, or if you have any other allergies. This product may contain inactive ingredients that can cause allergic reactions, so it's essential to talk to your pharmacist for more details. It's also important to inform your doctor or pharmacist about your medical history, especially if you have breathing problems, glaucoma, heart disease, high blood pressure, liver disease, stomach or intestinal problems, an overactive thyroid gland, or urination problems. Pain relief PM may cause dizziness, drowsiness, or blurred vision. It's advised to avoid alcohol or marijuana while taking this medication, as they can increase these effects. It's important not to drive or operate machinery until you can do so safely. It's also important to avoid alcoholic beverages and talk to your doctor if you are using marijuana. For those with diabetes, alcohol dependence, liver disease, phenylketonuria, or any other condition that requires avoiding certain substances, caution is advised with the use of pain relief PM, as it may contain alcohol, sugar, and/or aspartame in its liquid form. Before having surgery, it's important to inform your doctor or dentist about all the products you use, including prescription drugs, non-prescription drugs, and herbal products. Children and older adults may be more sensitive to the side effects of this drug, so it's important to be cautious. In young children, this drug may cause agitation and excitement instead of drowsiness. For older adults, the side effects may include dizziness, drowsiness, confusion, constipation, or trouble urinating, increasing the risk of falling. During pregnancy, pain relief PM should only be used when clearly needed, and it's important to discuss the risks and benefits with your doctor. This drug may also pass into breast milk and have undesirable effects on a nursing infant, so it's important to consult your doctor before breastfeeding. It's important to be aware of potential drug interactions with pain relief PM. Always keep a list of all the products you use and share it with your doctor and pharmacist. Be sure to inform them of any other medications or substances that may cause drowsiness, such as opioid pain relievers, alcohol, or muscle relaxants. Additionally, be cautious of other products that contain antihistamines, as they may also cause drowsiness. It's important to check the labels on all your medicines and consult with your pharmacist to ensure safe use. Furthermore, this medication may interfere with certain medical tests, so it's crucial to inform lab personnel and your doctors that you are using pain relief PM. Always follow your doctor's guidance and do not start, stop, or change the dosage of any medicines without their approval. If you suspect an overdose or notice serious symptoms such as passing out or trouble breathing, call 911 immediately. Otherwise, contact a poison control center right away. U.S. residents can call their local poison control center at 1-800-222-1222. Canada residents can call a provincial poison control center. Symptoms of overdose may include nausea, vomiting, loss of appetite, sweating, stomach/abdominal pain, extreme tiredness, agitation, confusion, flushing, hallucinations, yellowing eyes/skin, dark urine, seizures. In children, excitement may occur first, and may be followed by loss of coordination, drowsiness, loss of consciousness, seizures. If your doctor has given you a prescription for pain relief PM, it's important that you don't share it with others. Make sure to attend all your medical appointments and any necessary lab tests. If you have been taking pain relief PM regularly and happen to miss a dose, take it as soon as you remember. However, if it's close to the time for your next dose, it's best to skip the missed one and just take the next one as scheduled. Avoid doubling the dose to make up for the missed one. It's important to stick to the recommended dosage to avoid any potential side effects. It's important to store pain relief PM at room temperature, away from light and moisture, but not in the bathroom. If you have the liquid form, don't freeze it. And of course, be sure to keep all medications out of reach of children and pets. When it comes time to get rid of any unused or expired product, don't just flush it or pour it down the drain. Instead, consult your pharmacist or local waste disposal company for proper disposal instructions. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.